Good afternoon, everyone. Thank you for waiting, and appreciate you joining us this afternoon. So we are super excited to have with us folks from Texas Tech University to talk through their case study and their journey on their IT challenges and making a better clinical environment for their doctors and clinicians. So we're super excited about that. So before we get going, just a couple of housekeeping items. First of all, everyone will be on mute for the presentation, but we do want your questions. So you'll notice to the right of your screen there is a spot where you could type in your question. So if anything pops up during the presentation, please make use of that box, and we will make time at the end of the presentation to answer those questions. The next housekeeping item is that this is great information that the folks are sharing with today, and I know everyone's going to want this, so we will be sending out the deck along with the case study that they're going to be talking about today at the end of this presentation as well. So without further ado, I want to introduce our speakers today, and again, super excited to have them and really appreciate them taking time out of their day to share their story with us. So first of all, we have Carla Silva, Director of Clinical Systems Support, Jorge Caballero, who is the Director of Infrastructure Technology, and Iskra Hokobo, who is the Senior Network Engineer, all from Texas Tech University. And together they're going to be sharing their story about improving clinician workflow, productivity, and patient care. So thank you again, Carla, Jorge, and Iskra for joining us today.
Thank you for the introduction, Cindy. So again, my name is Carla Silva, and I'm going to just real quick go over the agenda. So the first thing that we're going to cover is who we are, some of the business challenges that we wanted to address with the solution, key questions that were driving our goals. We'll describe the solutions that we put into place, and finally we'll talk about the outcome. So hopefully you'll find this information useful. So first things first, who are we? We are Texas Tech University Health Sciences Center, and we are located in El Paso, Texas. We are not only an academic center, but also a multi-specialty clinic. We have physicians in the areas of family medicine, pediatrics, internal medicine, OB-GYN, surgery, to name a few of them. And we host more or around 220 residents, 230 faculty, and we are up to 400 medical students. There are 8 medical schools in Texas, and with El Paso being one of the fastest growing schools. Our school opened 6 years ago, but our clinics have been providing services for over 40 years now. We also have a school of nursing, and so with that being said, over the years we have trained over 4,000 healthcare professionals. Like I mentioned before, we are in El Paso, Texas, but so our patient population not only covers Texas, but also New Mexico, and some portion of Arizona. And right now, so we are up to 90,000 patients. So I'm going to give you a little background on how we started. And everything, so everything started with an EMR implementation 4 years ago. We started assessing our options for end-user hardware, and we went to visit our campus in Odessa. They had a virtual solution back then, and they were using top cards and roaming profiles, and we really liked it. However, at that point, we didn't have the infrastructure to support a solution like that, and we had a very aggressive timeline for implementation of the system. So the best solution we had to put into place was to install thin clients and PCs. As you can imagine, the physicians were very frustrated. We have around 8 applications that require a login. And for the EMR, which is the main one, they had to log in at least twice for every patient, because obviously the system will log them off after a certain period of time. So the initial login for EMR when they first connected to the system was taking up to 4 minutes. And then the reconnect session was taking up to 2 minutes. So if you do, the math right there, let's say that they're seeing around 30 patients a day, and they had to log in twice, so that is like 60, like an hour of productivity loss. Another issue that we had was the printers. The printers were configured by Workstation, and sometimes the device would not recognize the printer, and the end user had to go into the list and select the printer. And so that caused multiple issues because the providers will print all over the place. Sometimes providers from family medicine will print internal medicine or vice versa. And obviously they're not technical people. So what they will do is that they will keep printing and printing, and they will call us to report that the printer was not working. But little that they know, they were printing, but they were printing their job somewhere else. So we were not only wasting paper, but we're also committing a huge HIPAA violation. Another thing is that, as I mentioned, the clinicians were having to log in every time. So what this means that every time that they will open the EMR sessions, they will have to go back and look for the document where they left off. So that was very inconvenient for them. With meaningful use coming, and EMR being implemented and being so new for them, the least thing we want for them is to waste time to look for documents in EMR or getting locked off the system or worry about the printers. So the main objective was for them to focus on learning the new EMR system and worry about patient care. Another thing, it was managing all the end user devices. There were occasions in which we had to touch every single end device to install or push a change. So this was very, very painful and time-consuming for our team. In terms of equipment, as you know, PCs are very expensive. They occupy a lot of space, and then they have to be replaced every so often. And then last but not least, another HIPAA challenge that we have, other than the printing, was that the providers, in order to avoid logging back in, they will leave their desktops open. So that was open to the public, open to the patient, and as you may know, that's another no-no that we needed to take care of. So just to summarize our technology prior to implementation, we were using HP Think clients. We were doing normal PCs. We had Citrix session printers. Like I mentioned, our login were manual and very lengthy. And then even though we have a Citrix single sign-on solution for all application, it was not the ideal solution, and it will still be very inconvenient and lengthy. So with that, I'm gonna pass it to Jorge, and he's gonna talk about some of the key questions that drive our goals.
Thank you, Carla. Good afternoon. My name is Jorge Caballero, and I'm the Director of Infrastructure Technology for Texas Tech Health Sciences Center in El Paso. First of all, I want to thank Coretek for engaging us in this event and for using us as a case scenario. We're glad to share with everybody our implementation and the success that we have had so far. So anyway, some of the key questions that we had before we started this implementation, it's as you can see, I mean, there was some concern about the workflows, return of investment, complexity on the background. So anyway, basically what we did is our goal was to set up an efficient environment that will meet the needs of the providers and help us provide and improve the workflows. At the same time, we wanted to keep complexity at a minimum. So we discussed with upper management, the institution vision. We came up with an implementation plan. We did an extensive assessment to define the size and the specifications of the backend infrastructure. We engaged different vendors. We tested several solutions. And finally, after we decided what solution to go with, we requested for quotes and to be able to determine a budget. So some of the factors that we take into consideration were what applications are critical to ensure the providers have the tools to provide the best care to the patients, the number of providers that we have and the future projections, the total number of patients, how many work shifts, patients quotas, ease of management, and return of investment. So the solution, again, after we did extensive research and testing and assessment, we decided to go with a solution that we felt that, that it meets our needs. A solution that is scalable, it's easy to integrate and maintain, and an important thing is that it's a solution that it was certified between the different vendors. So in other words, as you can see on the slide, we decided to go with different vendors for different functions. So for CNAP, we selected CNAP, which is a Citrix product, because it fulfills the need to present all the applications to our staff in a centralized infrastructure. We combined that with Zen Desktop and Y0 clients to minimize the time, the resources needed to maintain the user devices, the endpoint devices. And then Absence, we use it to, the environment manager, we use it to simplify the application management and the user profiles. In Privata, single sign-on help us eliminate the need to repeatedly type user IDs and passwords and to be able to navigate from one application to another one. Something to keep in mind, the reason why we decided to go with the Y0 clients, it's on their Flash, there's already built-in drivers for the solution that we wanted to implement. Of course, all of this couldn't be possible without the guidance, the assistance, and the expertise of Coretek. They're a great partner to work with. They have an incredible team, all the way from management up to services, and their assistance in this implementation was really appreciated. So the bottom line, do your homework and do plenty of research, time assessing, testing, everything before you make a final decision. So I'm going to pass it over to Iskra Jacobo. She's going to go into detail as far as how we're implementing and how the application functions.
Good afternoon, everyone. My name is Iskra Jacobo. I am a server administrator for Texas Tech. And I want to say that during the implementation, I had the opportunity to work directly with the Coretek staff and the technical resources. So this diagram shows our clinical workflow, and it has the main components for our implementation. So at the beginning, at the top of the diagram, we can see the end user and the endpoint. This is the Y-Zenit devices. Then at the second level, we can see our Zen Desktop connection broker. Then underneath that, our Imprivata Citrix, Imprivata SSO agent. And all this virtual infrastructure is resides on a VMware ESX group of servers. We think this architecture has allowed us for maximum performance and functionality while we achieve our main objective, which was faster logins and users to be able to run from one desktop to the other one. In this environment, the printers, the drivers, the peripherals, and even the keyboard work exactly in the same manner as if the application was locally installed. We implemented this joint solution with 180 virtual desktops. Even though we keep growing every day, we keep adding more desktops. And this was implemented in 10 clinics, including 2 remote sites. Our clinicians now have more time to interact with patients because they can access their desktops and applications in 10 to 15 seconds, and they can reconnect to the desktops sometimes within 3 seconds instead of waiting 2 minutes. This definitely is leading us to increased operational efficiency in the clinical workflow. Also, with this solution, practitioners now use single sign-on to log onto their desktop and applications from a zero client, no matter which clinic or exam room they are. Once in the clinic room, they can log on into the exact same desktop state they just left, with the full information and patient context already displayed, so the clinicians can dedicate more time to their patients. We're very happy to see how the centralization and standardization of the virtual clinical workstations has brought simplicity and consistency to our environment, especially to us, the IT group that gets to manage it. Finally, we would like to stress that the real return on investment of our clinical virtual desktop solution is in factors such as the fact that we're able to tightly control who gets into our desktop and who gets access to what in order for us to improve regulatory compliance. Now we're able to update every desktop simultaneously by just updating them at the server level. We have reduced IT support costs, and we can lock down our virtual desktops so we can deliver a consistent user experience. Currently, we continue to add virtual desktops for more healthcare providers, and now we're looking into expand the virtual desktop to a broader workspace.
So Carla, Jorge, and Iskra, thank you so much for all that great information. It sounds like it was quite a journey, and we do have several questions here, so hope you're ready to field some of these. So first of all, let's talk about the end user acceptance. How was this when you rolled this into production? Did you get any resistance from your clinical community or pushback on new technology that you tried to force on them? You know, how did that part of this go?
Actually, we didn't. The goal initially when we implemented the EMR solution was to have something like that. So we kind of kept promising that we're going to bring it in. It just took longer than expected just because we had to put several items into place. So when we finally were able to bring it in, they were very, very excited. They were on the list. It's like, can we go first? You know, that's a different discussion, but they were extremely happy. And so no pushback at all. Very easy to I mean, it was easy to train them on that, and they really don't have to do much. So no, they were really happy.
All right, that's good. So what EMR are you folks using?
We are currently using GE Centricity.
And your PACS is Centricity as well?
Our PAC system is also a GE PAC system.
So for your IT staff, how is it for your IT team to support this now that it's in place?
It's really easy because, like I mentioned, now we just update the image centralized on a centralized manner, and then we can push it to all the end devices, as opposed to before when we had a hybrid client, we have to go and touch every single device.
Okay,
so have you gotten this down to just one single golden image?
We don't, and just because, you know, we have, like I said, we have multiple clinics, and there's, you know, differences here and there between them, and so we created, how many images do you have?
We have two.
We have two. So it's not that many. Like before, we had to create.
We have to go and touch every device.
Mm-hmm. Yeah, so it's really, really simple.
Okay, good. So you didn't talk at all about a BYOD strategy, bring your own device. Is that something that Texas Tech is looking to support?
We are in the near future. As of right now, we are in a transition from, we just became our own institution. So a lot of the things that we were doing were based on the things that Lubbock was doing. And so we're ready to bring our new initiatives, and that's one of them.
Okay, well that was actually part of the next question, is what's next for you folks? So BYOD is one of your next initiatives. What else is next for you?
We talked about We talked about VDI and the expansion of it in some other areas. It's something to look into, definitely. It's so easy to manage, and our campus is growing really, really fast, but I think that right now is the perfect opportunity because of the same thing, because we're just growing. And so bringing that technology in right now opposed to later where, you know, when we're huge and then we're trying to replace all the system is the perfect opportunity. So we're going to start doing assessments, and we actually already started doing assessments on what are the areas in which we could apply or implement something like this, and opposed to continue replacing our PCs, you know, make our back infrastructure more robust and simplify the work for our technical team, and that way we'll be able to focus on other initiatives, not so much in trying to support, you know, end user devices. So healthcare, you know, because healthcare is evolving, it's changing, so does academic. So there's more things that we need to focus on opposed to, you know, fixing and hooking up printers and things like that. Okay, got it. So we're happy that you settled on Coretek services to help you with this journey. And as you know from my announcement at the beginning, I'm with Coretek services, and this is what we call our signature solution. It's the virtual clinical workstation that we've rolled out to about 400,000 desktops across the whole U.S. And so we've seen all these different EMRs and the exact challenges that you're talking about. But for the folks out there who are looking at a solution like this to solve some of those same challenges, can you talk a little bit about what were some of the alternative solutions you looked at and how you came upon choosing Coretek? And I'm not looking for a plug here, just I want other people to relate to, you have a challenge here. How do you go about finding someone who knows how to solve this? And so what was the path that you folks went on, and how did you finally end up with Coretek? So particularly for us, this is what happened. The campus in Odessa had engaged Coretek before to implement their solution. So we were not trying to reinvent the wheel, really. We didn't, two things. It's very time consuming, and you know, when you talk to vendors, they tell you they can do everything. We were looking for a proven solution. So for us, it was very simple. One of our campuses had done it before. We went with the same vendor that did it. You know, we knew that the solution worked. We knew that they got the support that they needed, and so it was a no-brainer for us. While we were going to try to look for something that we already saw, working. So, and maybe not everyone has the opportunity, but in our case, that's exactly what happened. Even though the product that we're using is not the same, Coretek was able to adjust to our needs and look, and we told them, what kind of infrastructure we have purchased, because the backend infrastructure we already had it in place when we engaged Coretek, so they were okay with that.
And I'd like to say that before engaging Coretek, we tried to do a prototype of VDI on one of our clinics, and we rolled it out, but it was so slow. We didn't have all the knowledge about this product, AppSense, and Imprivata, and how you can integrate all the pieces together. So that's after that we engaged Coretek services, and you know the rest.
Right. The rest, as they say, is history. So thanks for adding that, Iskra. I appreciate that. And you bring up a really good point about how Coretek approaches things. And if I can take a moment here to put in a plug for Coretek, we're consultants first, and we don't look at suggesting technology first. We look at your environment first, understand what you already have, and do what we can to optimize and leverage what you already have. So as systems integrators, we're accustomed to working with all those different technologies, whether it's Citrix, VDI, VMware, Imprivata, AppSense, Unidesk, all the different SAN storage background, all the different networking and compute and all of that. And we really do try hard to leverage what you have. And it's another thing that's kind of interesting is that there's a lot of complexity in building this, and yet, as we talked about in the first question, when it comes to supporting it, once it's built and those complexities are kind of behind you, supporting it is very manageable, which you already spoke about. So that's what Coretek can bring to the table. And again, we're very thankful for the opportunity to work with you folks at Texas Tech University, and looking forward to doing a lot more great projects together. So if there's anything else that you folks want to add, that's all the questions that I had. And I want to thank everyone for attending today. And like I said, everyone who has attended will be getting an email with the deck and all this information. The case study, I think we're going to include another case study from Munson Medical up in Traverse City. A lot of the same challenges, a little bit different technologies that came into play, but very similar stories. And I think that's everything. So thank you so much, everyone, for joining, and have a marvelous rest of your afternoon.